All right. What's up, everybody? Welcome back to the Fit 40 podcast, where we simplify exercise and nutrition for busy parents 40 plus so they can improve their health and feel amazing. I'm your host, Brian Fitzsimmons, and today we have an incredible guest with us. We have Vinny Russo in the house. He's the director of nutrition for Balanced Bodies, Project Transform, and Standard Practice. He's also a personal trainer. He has coached hundreds of clients over 14 years. He's got his master's in applied clinical nutrition, and he is a new father. So we've got a lot to talk about today. So Vinny, welcome to the show.
Thanks, Brian. I appreciate you having me on. And yeah, just to give a quick background on like how we met. So Instagram, man, brought us together. So going back and forth liking each other's content. And yeah, I'm happy that you asked me to come on, man. Really am.
Absolutely. And I think one of the big things that stood out, and I know I mentioned this to you in the messages, is we're both in a bit of a unique position, being that we're personal trainers and nutrition coaches who have a significant other in the medical field. Yeah. Because it could be a little combative almost, like with coaching and personal trainers saying doctors don't know anything, and we're just sitting there like
grinds my gears, man. Grinds my gears.
Yeah, because I know, like, actually, before I get into that, I'd love to hear your personal story, because I know I heard you on Aram and Jimmy's podcast, which you guys should definitely check out after this, the Other Side Lifestyle podcast. But how did you get into the personal training nutrition space, and how did that change when you met your wife when it comes to the whole accumulating information and helping clients?
Yeah. So my whole thing was like, I started competing really early. 2011 was my first competition. It was like right out of college. I played college football, right? So, and I wasn't going anywhere. I was going to make the NFL on 5'10" on a good day. So
I got to ask, what position?
I actually went in as quarterback, and then I played outside linebacker. So yeah, just
well, that makes a ton of sense. For those people who can't see on YouTube, really handsome guy. Of course, he's a quarterback. So makes total sense. I'm not quite as handsome. So I was an tight end, D end. We get hit.
Nice. Yeah. Big guys, man. You got to push people around and you still got the speed. I like it. Yeah. So basically what happened was I was like, I still have this competitive nature. I'm not playing men's softball. So what can I do? I'm like, I'm always in the gym. And I was just like, I want to dial myself in and try competing. So I hired a coach, and we didn't change anything with cardio. We didn't change anything with strength training. He just adjusted my nutrition, and my body completely transformed. And that really got me obsessed with nutrition. So then I went and got all these certifications. Half of them I don't ever use, and I wasted money on. But I also got my master's in applied clinical nutrition, like you said. My background was in biology. So I was able to kind of just go right into that. And then I started trying it with a few of my friends, and it just blossomed into me really helping people with nutrition and being pretty damn good bringing people to stage. So basically, to kind of shorten this down a little bit, when it came down to like being a personal trainer, I only did that just because I knew what I was doing with training, and I got my NFPT certification, and I was able to train people just freelance. So I would hop from gym to gym. I get yelled at a bunch of times. I get kicked out. Go to home gyms, that type of stuff. But my main passion was nutrition, and I definitely wanted the business to be nutrition. So I was a teacher. I'm teaching high school science, and I was starting my nutrition business. And when it got to the point of where like I didn't have to teach anymore, I was like, I'm definitely not doing this. We just had like COVID, and the kids came back and they were able to fail tests, and we couldn't fail them, and it just didn't resonate with me anymore. So I was just like, I'm out. I don't need to do this anymore. And it was the best decision I ever made. But then getting involved with my wife, so she really opened up my eyes to a lot of things, because she's the most intelligent person I've ever met in my entire life. And I'm not just saying that. She went to college at 14. So yeah, she's up there, man. But basically, we would have conversations about like supplements. And she would just go into like, one of her main things when she was doing her master's was like to look at research and say whether it was legitimate or not. So she would go in and just like destroy like everything that I was saying. And I'm just like, I can't compete with this. So then she just
gotta come with the receipts, man.
Yeah. So then it just like really opened my eyes to like how much BS. Could I curse on here or no? Because they come out sometimes.
I don't fucking care. All you.
Yeah.
No, there's no rules here.
So yeah. So like it just really opened my eyes to how much bullshit the research was with supplements. And then it got me thinking, like, what else don't I really know a lot about? And I thought I knew about labs. And then, like, thank God, like, she's our team physician. So now she does all that because she's legitimate. She knows what she's doing. She's qualified to do it. But she was just nitpicking a lot of stuff that I was doing for the benefit of us as being not only partners in life, but also partners in business too. So she opened my eyes to a lot of stuff that really changed my mind. But overall, it was kind of like I need to stay in my lane, which is nutrition and training and daily movement and habits. Let her take care of all the internal environment, medicine type stuff. Yeah, so I don't step in her lane, and she doesn't step in mine. But it's cool because we get to bridge the gap between each other, right? Like I'm a nutritionist who doesn't have the internal environment qualifications in terms of medicine. She does have that, but she doesn't really have the nutrition aspect. So we bridge that gap.
Yeah, it is interesting where it's like if at any point, like the average doctor, like right around the corner, wanted to take a look at our certifications or like what certain people are spewing on the internet, they
Yeah.
would run circles around
Oh, yeah.
most people. And
Yeah.
they just are working with patients 24/7 and we don't see that. So it's
Yeah.
and I mean, I know the big thing that my fiance pointed out when it came to quality of research is like sample size, for example. We're
Yes.
pulling conclusions from sample sizes of like 10 people.
Yeah.
And
No.
meanwhile, she's like, I don't even look if it's not at least 1,000 people. I'm
Yeah.
like, shit,
Yeah.
there's no way we could get that many people for a metabolic ward study ever.
Well, now, not with nutrition. Definitely not
No.
nutrition. Yeah. It's almost becomes inhumane if you try to do that and really control them to that extent. So, but yeah, you hit the nail on the head, man. It's just like that was a big thing she pointed out. Was like, oh, you have an N of 20. Yeah. That needs to be at least 50. And I'm like, for what? She's like, to be significantly, to have some significance. I'm like, oh, all right. I didn't know that. Yeah.
Yeah. And not to mention, most of the stuff we look at is like college age males that are just trying to get credit for whatever courses they're in when it comes to a lot of the studies that we look at, but
Yeah.
not all, but most.
Well, she didn't even know what functional medicine was until like me. And now
Yeah.
it's like she doesn't even want to listen to certain people. She blocks certain people. She's like, this is terrible. Like how they could put out this information. I'm like, go on social media, like you be a hit. Like if you just went on there and just destroyed them. She's like, I ain't got time for that. I'd rather not. She's like, I
Yeah.
wouldn't waste my time commenting on people who don't want to know the truth. It's like, good point.
Yeah, I mean, they're in a unique position because it's like they make more than enough money and they're helping people in a way that they can help. Why spend time on social media? Which is
Exactly.
why people got to realize like the people, especially the medical professionals you see online, usually are not the cream of the crop. Like I
Yeah.
know there's a couple people from my fiance's medical school that barely passed. Some didn't even make it, and they're just finally finishing because they were too
Yeah.
busy spending time on social media and like doing photo shoots when they should
Yeah.
have been studying.
Yeah,
It's
yeah. It
wild.
was funny because she actually sent me something like I think it was 2 weeks ago. She sent me a legitimate physician. I was a board certified endocrinologist who now left her practice just to do stuff with social media because she gets paid so much because of how many views she gets. And she's like, this woman is legitimate. Like she's on TikTok and Instagram. I don't know the handle off the top of my head,
Oh, we
but
got to find it after.
she's on Instagram, she's on TikTok, and she's like, she makes so much money doing that, and she could be home with her kids, and she's choosing to do that. I'm like, makes
Yeah.
sense, but damn, that could be you, right?
It's like, come on, babe, it could be
Yeah.
you. But yeah, not to harp on that topic too much, but I do think it is important to bring up. Oh, and also in my notes here, I had to ask when it came to, you said you were a high school teacher in
Mhm.
Rahway, correct?
Yes.
I grew up
Yes.
5 minutes from there.
Did you really?
I grew up in Cranford.
Oh, no, I grew up in Kenworth.
Oh my God. So
Yeah, we're right over
we
the fence,
probably are
actually.
like blocks away from each other.
Yeah, 100%. Yeah, yeah, because we're neighbors, and then we're always like 5, 10 minutes from there. So
Wow.
yeah.
And it took Instagram to find you here. And I have a best friend from college that I didn't meet until we went to West Virginia that we grew up 2 blocks away from each other.
Oh,
It's
that's
what
insane.
sometimes it's wild.
Yeah,
But
it's
anyway,
insane.
to circle back before we get too off track. So one thing I wanted to talk about when it comes to the medical side of things and how it kind of seems to get a little muddied with the nutrition and the training is the concept of blood work and how it's
Mhm.
interpreted, how it's actually applied. Because to be totally frank, like I'm in a position where I'm like, leave the blood work to the doctors and I will do whatever they say to get your blood work in a better position. Where exactly do you stand and how do you like to utilize blood work in what you guys do?
Yeah, I'm like, let her do it. Plain and
Yeah.
simple. I'm not the qualified one. She is. If I didn't have her, but I learned the same stuff that I've learned from her. But let's just say she wasn't working with our company, I would refer out. Definitely would refer out just to have someone qualified do it. And this is not a knock on like functional practitioners. Well, maybe it is for them, but definitely not a knock on like nurse practitioners because they know a lot. They do. But a lot of them I see kind of leaning towards that functional side where they're ordering tests that they shouldn't order. A big one is like reverse T3. Like you do not need that. Like if you're in the ICU and you're under chronic stress, that's like when you get the reverse T3. You don't need that. That's not going to tell you how your thyroid's doing. But a lot of people are doing that now. And a lot of nurse practitioners in these clinics are doing that too. Like I said, it's not a knock on them. Maybe it's just kind of what they believe in. But I know from my understanding with the research that I've done, plus the endocrinologists we've had on our podcast, the Balanced Bodies Blueprint, and then what my wife says, like half of those tests, man, you just don't need.
Yeah. I know that a big thing right now is, especially with certain companies that are teaming up with coaches, is like, let's get you 500 different types of markers. And
Yeah.
I mean, for the average person listening, they're like, probably like, oh, that's awesome. Like, I'll be able to see everything and be able to find all of my issues. But what exactly is the problem with that?
Yeah. So, do you mind if I rant a little bit or?
Oh, please do. The floor is yours.
Yeah. So at first glance, like, running these hundreds of tests, it seems like it should be like a gold standard for personal care. But the reality is that more testing doesn't mean better outcomes. It just means more confusion. It means like more false alarms. And it's an opportunity that some people will take advantage of for misdirection. Right. So when you're thinking about it, there's a bunch of different downsides of ordering tests. The first one that I would say is information overload, right? Where you're getting a lot of confusion and not so much clarity, right? So when you order 100 plus biomarkers, it creates a lot of noise. And many of those biomarkers, they're not clinically validated and they're not actionable. So when something comes back that might be slightly out of range, something that would never trigger a concern in conventional medicine, it now gets labeled as like, here's your root cause. This is the reason why you're feeling this way. And then that's where you cue in the unnecessary supplements or you go with these named diets and then you wind up testing again and again. And the loophole just never ends. So I would say information overload is a big downside of it. There's also false positives where you basically like manufacture problems because when you have more data, that brings in more maybe issues. And I throw that in air quotes because you might have some values that might be a little bit high or maybe a little bit low or just different from the range that the lab actually put out there, right? So now you're going to have these abnormal numbers and that's going to lead to anxiety. It can lead to over supplementation and it's going to lead to wasted energy on chasing problems that don't even exist. And I feel like that is textbook overdiagnosis and over treatment. And it was actually a major issue that was flagged by initiatives like Choosing Wisely, which is from the American Board of Internal Medicine Foundation. So that would be another downside. There's another big one, which I feel like is the most dangerous, which is what we kind of just touched on, and that's untrained interpretation, right? So, and I'm going to label them as functional coaches because that's where I see it the most. Most of the functional
And even with those companies, it's usually not a doctor that's interpreting for you.
Yeah. Well, you don't know who's interpreting. A lot of it
No.
is kind of just like, well, send it in and then we'll give you the analysis. It's like, well, who's analyzing it and what qualifications do they have?
Are you using like AI? Because I know at least my fiance has told me many times, like they'll get readings from the computer and be like, this is not right based on the interpretation. But because we know what we know, we can say, okay, it's actually this going on.
Yeah. Yeah. 100%. 100%. But that's the thing. It's like, if you don't know who's interpreting it, how can you trust the solutions that they give you, right? So this untrained interpretation, I think, is probably the most dangerous, and that falls a lot on like the average coach needing to show more merit than what they have, needing to be like, I can handle this, I can handle this, I can handle this. When you really can't, it's okay to refer out. People will respect you more if you actually refer out. And then one that my wife told me, which it didn't really hit me in the face until she said it, is like the lack of outcome improvement. So you get all these tests, and let's just say you do move the needle in the direction that they want it to move. It's not really going to impact your overall health, right? If you're looking to impact your overall health, there's a few labs like your CBC, your lipid panel, your TSH, and your HbA1c. Those are like the ones that, like, if you move the needle in the right direction, you will see improvement in your overall health. These other ones, like the reverse D3 or even the cortisol from friggin' Dutch tests, even that stuff, like It's
Yeah.
not going to move the needle. Like you want to help you feel like you have elevated cortisol, focus on your sleep. Like do that. Don't like
Yeah. See an endocrinologist, please, instead of relying on these testing companies and a coach.
I was just going to say that. It's like if you're going to, if you get a lab test back that shows that your TSH is low normal, you don't have to run and go get a thyroid supplement that has fucking pig thyroid in it. Instead, go see a specialist, an endocrinologist who specializes this, spent over 13 years trying to figure out what's going on with the hormones in the human body. Go to them so then they could give you actionable advice.
And I'm glad you brought up the 13 years because I think that also is another thing that people like general public just doesn't seem to know that like
Yep.
when we're putting say doctors on a pedestal, the reason being it's like we know that hey, they went to medical school for and then they did their residency and then they did a specialty and they did all these things over the course of 10, 12, 14
Yep.
years. And it's
Yeah.
like how can somebody learn all of that in a certification?
Yeah, it's funny. It's like bringing this up because there's a very well-known functional person out there right now who's probably the biggest functional practitioner that there is that I've seen on social media. And he put out a message saying like he got a comment from a person who's in medical school saying like this guy's not doesn't never made it in medical school. Why are you listening to him? And he's like, well, we don't want to sit around and wait for you to finish your finish medical school, finish your residency, finish your fellowship. What do you mean you don't want to wait for them? Like they're becoming specialized to become the experts in that area. So he was knocking these doctors for going through so much schooling to become the experts. He was knocking it and he was saying, yeah, we don't want to wait for that. We need help now. It's like, come on, man. Like that was the biggest turnoff. And I followed that guy a lot. I don't want to say his name, but I followed him a lot. I actually trusted him for a while until I started reading the research that he was putting out.
Yeah. And
Yeah.
then it's interesting too. We don't have to go down this rabbit hole, but when we do see research that is cited, because that's usually how many people put themselves in this position of authority where they say, oh, because of this study, this study, this study. But then when we go into the simple stuff like sample size or like what the actual methods were, and if it was in humans versus rats versus petri dish, it's like
100%.
they're usually citing garbage.
They're citing rodents and in vitro. And listen, Lane Norton says it the best, and he screams it out: randomized control trials in humans. Like it's the truth. That's what you go by, and that's it. Like it's not going. You can't get something from a rodent and think that that's going to extrapolate over to a human. It doesn't work like that.
Exactly. That's I'm not sure the exact name for it, but it's preliminary. It's like there's levels to this. It's if
Yes.
they see something significant in vitro, then it's levels up to rats. Then if it
Yeah.
goes to rats, then they level up to humans. It's like if they don't get to that human part, then why are we paying attention?
Yeah. There's that progression model right there. That's what you need.
Yep.
And if they didn't take it into humans, there's probably a reason for that.
Exactly. Exactly. Now, I like the fact that you brought up outcome improvement because this is one of those things that we see a lot on social media where people talk about these nitpicky things of like certain things being harmful and all this nonsense when it comes to say fruits and vegetables. Because if you
Yeah.
do pick it apart at a molecular level, then yes, there are certain things that you could be like, not good for you, not good for you. But the collection of it is very beneficial. When it comes to, say, what you mentioned, when it comes to A1C, when it comes to, say, blood pressure, things like that, what are some things that you like to implement that do improve these big health markers that you see on blood?
Yeah, a lot of it's going to be the lifestyle stuff. Like stick with the foundation, stick with the basics. And just to touch on what you just said, yes, I agree with that 100%. Compounds in isolation don't function like that in the real world. Like it's a combination of things. That's how they function. So I'm glad you said that. But yeah, so if I'm going to address these blood markers, especially the ones that are going to move the needle, like the lipid panel, even your blood pressure, HbA1c, it's going to be mainly lifestyle stuff. So if we're looking to focus on, let's just say, the lipid panel, we're going to look to replace saturated fats with unsaturated fats like olive oil, fatty fish, some nuts, even seed oils. Yes, even research shows that seed
I thought
oils.
they were inflammatory.
Oh my God, no. Even though the research shows that they improve health markers more so than saturated fats do. So I would definitely do that. I would go with a diet that's a little bit higher in soluble fiber, regular aerobic exercise, just get that daily movement in, and then weight loss will help your lipid panel 100%. So that's what I would do so much with the lipid panel, with blood pressure. A couple other things kind of come into play. Like obviously the physical activity is good in losing weight. but reducing sodium, and I'm a huge fan of sodium. I'm a huge fan of using salt on everything. But if you do have a blood pressure issue, you do have to reduce your sodium intake. And you might want to increase your potassium-rich foods like your bananas, your potatoes, your leafy greens, and then obviously limit alcohol. That's a big thing with blood pressure. And then for your HbA1c, which basically tells you whether you are, pre-diabetic, diabetic, or in the green zone, weight loss is going to be the biggest driving factor there. I would say resistance training, because you'll become more insulin sensitive over time, focusing on your sleep, reducing some stress, and then carbohydrate quality. So focusing on stuff that is very nutrient dense, maybe even go a little bit towards low glycemic until you start getting that number under control. But if you just look at everything there, it's all lifestyle stuff. It's not like you need to have a glucose disposal agent before every carb meal to help you with your HbA1c, or you need some adrenal formula for your cortisol levels, or you need, like I mentioned before, something like a thyroid supplement that has bovine extract in it, which is basically like artificial animal thyroid that they're giving you, which is almost like a medication. So focus on the basics. The basics are going to be everything. They're just not fucking sexy, so no one likes to do them. And that's the issue. They want something that's going to be quick. They want the coolest supplement to come in and fix them. And it doesn't work like that.
Yeah. And there was so much that I was jotting down as you were saying all that.
I saw you writing.
I was like, oh God, I gotta bring this up, gotta bring that up. Because I know when you were like bringing up, say, one of the things I was thinking of was the cholesterol, because I know that's like a very big one that people are really confused on. Because I love just sending my fiance, I follow Carnivore Cringe. Have you ever seen that account?
No, I don't think so.
If anybody listening is interested in what exactly the outcomes are of carnivore diets, go and follow Carnivore Cringe, because I sent her one yesterday. There was like a dude in his 30s who had a total cholesterol of 700. Their LDL was 650. And I'm like, hey, babe, what do you think about this? And she's like, that's a walking heart attack.
Yes. Wow. That's insane. That's the problem with these fucking name diets. The only named diet people should do is if you're going to follow a named diet, right? Everyone's diet is going to be different, like depending on what you prefer and what your schedule is and what it allows. The diet that's best for you is the one that you can follow, right? But if you are going to stick to one name diet, the Mediterranean diet. When in doubt, Mediterranean out. And that's it, because there's so much research behind it and how it improves overall health. Just do that. Like worst case scenario. Don't go to this, I got to do carnivore and just eat meat and forget fiber and vegetables and you don't need it. And fruit has sugar. Like, no, because what you just said, their cholesterol numbers alone, walking heart attack. Drives me nuts.
But you never hear about that. You only hear about the success stories, because nobody wants to be that person that brings down the thing that they thought was the answer.
Yeah. It's funny because like I would go on TikTok and I love going in like lives with coaches who are like, hey, give me like your height, age, weight, and like your activity, and I'll give you your calories that you need to lose weight. I'm like, you don't even know their diet history. So I go in there and I like kind of question them, debunk them a little bit. But I was seeing that I made a comment on this one post, and it was this guy who said he did the carnivore diet and all his knee pain went away. He was like, I'm down 40 pounds and all my knee pain went away. It's because of the carnivore diet. I'm like, no, it's because you lost fucking 40 pounds. It's not the carnivore diet. No, it's the carnivore. All the inflammation from the carbs I was eating. I'm like, guy, where's your research? Like, let me see it. Where's your research? Dude, it's because you lost the weight. And that's it.
Yeah.
So, but
it is wild. Yeah, it is wild how people will take these outcomes that we know help certain things, and then they accredit it to the diet. It makes me think of the people that take fat burners and they're like, well, I really wanted to accelerate the rate of fat loss. So I started working out more and I started sleeping and I started eating better because I really wanted to make the most out of the supplement. And you're like, you really think it was the supplement that did that?
Yeah, 100%. It's kind of like people who are trying to like fix their gut health and they start focusing on what they're actually eating. And they like start taking these supplements along with it. And they're like, oh, it's the supplements that are helping my gut. And it's like, well, are you sure it's not like you changing your diet around and focusing on those foods and actually staying consistent? Because that's probably the bigger reason why you feel a little bit better, not the supplements.
Yeah. And it's a very easy trick to pull as a professional in the nutrition space to put somebody on an elimination style diet, because that's why you see these people putting these generic posts up saying go gluten-free, dairy-free, all this free, and eliminate everything. Because chances are, maybe there is an irritant that you individually respond to that they're going to catch, but that's a lot of bath water and baby thrown out.
Yeah. That's probably the perfect way you could put it, is you're throwing the baby with the bathwater.
Yeah, when all you needed to do was take that little droplet out of the bath.
That was it, right? Yeah, skim the top and you'd have been fine.
Yep. It's crazy. I'm thinking of worse analogies here, but I'm going to cut myself off. But I'm curious when it comes to the client facing side of things. I know you brought up some great ideas as far as the nutrition and everything like that. And I listened to one of your recent podcasts where you talked about doing, say, a rush cut. And
Yeah.
before we get into that, I know another thing that you brought up was a priming phase. So I'd love to talk about like what a priming phase would look like and why most people need one, and then how that would basically make a rush cut appropriate.
Yeah. Yeah. So the primer phase, and I'm not going to get like very sciencey or like into details here. I'll give like a general overview. And then if you really want to dive into details, I don't get too sciencey on my podcast, but it's just a little bit more in depth. So basically what the primer phase is, it's to optimize the body, right? It's to get it ready to respond. A lot of times, many people who want to start a diet just need one, they need structure, right? They need consistency, they need structure, they need consistency, and they need accountability, right? Plain and simple. That's really what they need. The primer phase is used to make sure that everything is ready for you to go into a dieting phase. I've seen this a lot with a lot of when I was doing a lot of competitors in my early years. When they like I have a few bikini competitors go from one competition to the next, and they're like, "Oh, I'm not responding." I'm like, "You're not responding because you are deficient in your micronutrients right now. You're very low in calories. Your body doesn't want to move anymore. You got to feed it. You got to let it relax." And that's the thing. And a lot of people who go from diet to diet to diet, I call them chronic dieters or diet hoppers. They don't ever allow their body to normalize. They don't ever allow it to gain a little bit of weight. They're, God forbid the scale number goes up. Like they freak out and then they go back into another diet. And that's the issue because you're depriving yourself so much that your body is not ready to respond. So the whole entire point of a primer phase is to get it ready to respond. And the way you do that is you bring down some activity level, you start feeding up, you make sure all your micronutrients are covered. It's not just macros and calories. That is the biggest driving factor in whether the scale is going to go down or up. That's yes, 100%. But how you feel and how you respond come down to the micronutrients as well. So you want to make sure your diet is very nutrient dense, and you got to feed up. You got to give yourself some. I call it water from the cup, right? If you have a cup of water and the amount of water in your cup is the calories, if you have a near empty cup, you can't really pour from that. But if your cup is full, you can pour from there and you'll see a response and you'll be able to go into a dieting phase. So the primer phase is really just to set you up to prime your body to respond optimally. The worst thing you could do, and I do this with my clients all the time, is like, I'm not making a change to your diet because we're responding. So I'm not going to waste a manipulation to get like a suboptimal response. Every time I make a change to your diet, I want you to respond maximally. And that's what a primer phase will do in the larger scheme of things.
And when it comes to, say, athletes who are competing versus like Gen Pop, what do you do differently, or what exactly would you say is a big differentiator between the two groups that you might change some things?
Definitely with Gen Pop, it's going to be focused more on nutrient dense foods. Some competitors usually eat that. They usually have that. They're always eating vegetables just for satiation factor. They're high in protein.
They
So
know the game they're playing.
exactly. So the main thing is really going to be the nutrient density of the diet and then the structure of it, like staying consistent. With competitors, listen, they're easy in that sense of that they'll do what you want and they already have a pretty good foundation under them. But it's very, very tedious, especially when you get down to like peak week and then bringing them on stage. And God forbid you don't place first, then it's your fault as a coach. So
They never want to blame mom and dad for the genetics.
no, never. Listen,
No.
I accepted that. I accepted it. I knew I wasn't going to do it. Like, that's why I went from NPC to the WBFF and then WBFF to FMG because NPC, genetically, I can't compete with those two. They would dwarf me on stage. Like leanness,
That,
yeah, I could get there. But in terms of size, not a chance.
that's why I keep this little guy right there.
Yeah.
Because I'm like, hey, I got fourth place, but I'm damn proud of that. Genetic, or not genetic, but the pharmaceutically enhanced folks. I went in natural.
Yeah, that's crazy, man. Good for you. Good job.
Appreciate
Shit.
that.
But yeah, so the biggest difference between Gen Pop and the competitor is going to be their nutrient dense diet and then the consistency with having some structure under their belt.
Yeah. Love that, because I think a lot of people do get mixed up in the athlete versus Gen Pop conversation because they try to apply athlete concepts to something like they're not even there. They're not even remotely close to there, but they want to use these techniques to speed up the result.
Yeah, it's like the general population looking at like muscle and fitness and seeing Ronnie Coleman's workout and like going to do that, thinking they're going to look like Ronnie
I
Coleman. It's like,
mean, I can't say I haven't done that with Branch Warren's leg routine.
we've all done that. We've all been there, especially starting out. But there needs to be an expectation, right? Like you're not gonna, you got to understand you're not going to get there genetically. You're not going to get there. That's like less than 1% genetics that someone will get there. But I just think that analogy kind of fits where it's like, well, if I see someone who has 1 million followers and a really great body, some female who of Latina descent, where she's just gifted in certain areas genetically, and they want to do her glute routine, well, come on, like it's not going to be like that. So when you're looking at the diet with Gen Pop versus like a competitor, they don't go hand in hand with each other. They don't.
Yeah. And that's sometimes,
Can someone get results using a bodybuilding diet? Yeah, I mean that's the foundations of a bodybuilding diet: higher protein, whole foods, non-processed foods, eat like a few meals a day. Yeah, like stay hydrated. It's kind of like a foundation. So people will see results on that, but is it sustainable? Can they finish that? Because if you ain't used to it, you're not sticking with it. Plain and simple.
yeah. And if you're using one of those like cookie cutter ones, like the stereotypical, there are a lot of coaches out there that do one bodybuilding show and then take their diet plan and say it's theirs and they give it to every single client. And if you do fall into that, just know that it will follow those principles, but the amounts just aren't going to be the right amount for you.
Yes, yes. Thank you for saying that, because that
Yeah.
is 100% true. And it's funny because like I'll have clients that are like, "Oh, my wife's going to do what I'm doing." I'm like, "That's not going to work for her. You want to
Yeah.
eat the same foods, fine, but she doesn't know the portion size she needs. She doesn't know her calories and her macros right now. So, yeah, good luck."
Good luck. Now, a couple of things that stood out to me when you went in depth on the primer phase, for example, was like how stress plays such a big role. And people don't realize that adding a calorie deficit on top of that
Yeah.
is double stress. So I'm curious, when you have somebody who is just normally super type A, super stressed, and that's kind of just their life, how would somebody like that, how would you prefer to transition them to a calorie deficit?
So, am I bringing them into the primer phase and then to a deficit? I mean,
I'm
like,
curious, like if somebody showed up at your doorstep day one and is like, I work a really high stress job, like how are we going about this?
yeah. So if we can't, if your job, which is your income, and you can't change that, if that's going to be the stress, we need to look at what other areas of stress are we going to have, and then also, is this the right time for you to diet down? Right. That's going to be really important. Like if you're like, I could go either way, then probably not. Like let's let you get your shit under control before we actually throw a little bit more exogenous stress into your life. But if they're like, no, I need to do this, like I really want to do this. I've been wanting to do it for the last 5 years and just never did it. So now it's time to pull the trigger. And she's talking to me like this fast. And I'm like, oh shit. Like, yeah, she's strong right now. I'm going
Yep.
to see what other areas we could pull stress from to reduce stress. And I don't want to get woo woo-ish or anything like that, but something like walking in nature alone will help. I do this thing with my clients. And if you listen to their ROM podcast, you probably heard it, where I tell them to like get in the moment, right? Get out of your head and count how many different noises you can hear and then name those noises. And then do the same thing with how many animals you see and name those animals. And then what colors do you see, name the colors, and smells, and so on and so forth. But so you find different ways to reduce that stress, and you add in some things that can help reduce the stress, which would be something like a walk in nature. But if they're doing crazy amounts of cardio and they're trying to work out 5 days a week, we're going to go down to 4 days a week. You're not going to do cardio every single day post workout. You're going to do it 3 times a day. You're not going to do it fasted in the morning. You don't need to do that. Do it when it's convenient. Don't stress about it. They kind of just change the narrative within their head. Because a lot of times those people are so stuck on like, this is what I need to do and I'm going to do it. And I don't care what anybody says. Even you're my coach. Like, just tell me that I need to do this so I can do it. And it's like, wait a minute. You don't have to do the fasted cardio. If you want to, great. But if you're stressed the fuck out, sleep in a little bit. Sleep in and go do it later when you have time. And if you miss it, so what? I'm going to give you an amount that you have to hit per week. Maybe it's 3 times per week. It could be any 3 days you want. It doesn't have to be Monday, Wednesday, Friday, right? So you just change little things and you try to change the narrative within their head. And what's great is like over time, and I see this a lot with people who are afraid of carbohydrates, like over time, they start to trust it and then they realize it. And then it becomes a whole new like euphoric lifestyle that they're living where they can enjoy themselves, where they're not stressing out of getting that fasted cardio in, or they're not stressing out of like, I can't have rice. Well, you can have rice and you can see amazing results with rice. So I think that transition, the way to do that is just changing some narratives within their head and then showing them and allowing them to say, hey, if we do this and it doesn't work for you, we'll go back to what you want to do. But just try it. Just try it out because you know it's going to
Yeah.
work. So you get them to try it and then they see it and then they believe you.
Yeah. And if anybody's listening right now and just the thought of that sounds like, oh boy, I don't know, like
Yeah.
just know that that's totally normal. And
Yes.
it just really takes dipping your foot in the water and trying it out and feeling it. Because I know when I was at my old gym, what we used to do at the end of all the group workouts is like parasympathetic breathing, where
Mhm.
it's like you just lay down and get out of your head and just focus on breathing. The more yoga style
Yeah.
stuff that they walk you through, and you could literally see people physically just
Yeah.
like it's wild, and it just sets up your entire day, and it could literally change your energy for the entire day.
Yeah.
It's wild. But the other thing too I wanted to touch on was like how you said social connections, like you just alluded to, how it plays such a big role with stress. Like, and along with that, a lot of people struggle with social situations. So when it comes to the idea of exposure therapy, for example, but they're getting these social connections, how do you like talking people through balancing them out where it's like we're reducing stress, but at the same time, we're getting some good practice?
Yeah. I lean on the practice. I don't even say stuff about the stress. It's like, look, if you want to make this a sustainable lifestyle, you have to know how to navigate those situations. If every time like something comes up, a holiday, and like you're in a diet and you avoid it, you're never going to learn how to go through it in life. And then you're always going to be avoiding stuff. So why not make the mistakes now with me, having your back here and then kind of helping you through it. Make those mistakes with me now, get a bunch of practice, do it often. Like I tell my clients all the time, like go out, have girls' night, have date night with your spouse, go do it. Go on vacation, set up vacations. Don't like wait until like after you're done with the diet to go on the vacations. You could do that, but don't avoid them either because I want you to have that practice. The only way you're going to get good at it is through that practice. So yeah, I don't even really lean on the stress aspect of it. I'm just like, the only way that you'll know how to do it is by doing it. And I have your back right now. And what we'll do is like, especially if they're going away for a couple of days, I'm like, all right, so what you're going to do is you don't have to keep like a crazy journal. Just write a note thing down in your phone and just say like each day, what did you do really well? And what do you think you could have improved on? And then you're going to keep doing those things that you did well. But the things that we improved on, how can we improve on them just by a little bit? Maybe you're like, oh, I had dessert, but I ate the whole thing and I felt terrible afterwards. All right, well, have the dessert next time, but now eat half and share it with someone and then see how you feel after that. Because if it works, you feel better, great. We'll start using that, right? And see how your body responds over a couple of days. It's not like avoidance of the dessert. It's like, well, if you felt that bad, let's reduce it down a little bit. Still do it, but just not that much.
I love that you said that because avoidance really, if we're going to break it down, is an extension of that all or nothing lifestyle where
Yeah,
it's like I'm either having it and I'm going balls out or I'm never ever touching the stuff.
yeah,
And we wonder why we get stuck in these cycles. Now, when they've hit that point where say we've got everything locked and loaded, all these habits are good to go. And say somebody did want to jump into a calorie deficit. And I know you talked about in one of your recent posts about a rush cut. Like,
yeah,
what would a rush cut look like compared to what you'd prefer a calorie deficit to look like?
yeah. So rush cut is more extreme. It's more like, hey, listen, like I usually say, 5 to 6 days out of the week, it'll give you really good results, right? If you want to start treading water and you want to stay like at maintenance for 4 out of 7 days, with a rush cut, you're going 7 days out of the week. Like you gotta be ready in 2 months and you're not in the position that you need to be, you're gonna go all out. Like I don't ask for perfection, but here I'm gonna push for it. It's a little bit more than consistency. It's a little bit more extreme. The calorie cuts that I would do, it's not that I do more in terms of like the number that I'm cutting. It would be they happen more often. So instead of waiting, another week or so for the body to really become stagnant, if I start seeing it slow down, I'll start that manipulation right away just to keep them going. Now, to me, I'm against it. And you saw my story today where I'm like, I'm not for that at all. But if you're going to pay me to do that, then you're going to have to stay with me afterwards because I'm not going to leave you hanging and you can't come back to me and be like, dude, like, what the fuck did you do to me? Like, why can't I eat the normal amount of food? I need to be able to make sure that you establish the maintenance after that. But in terms of like what it actually looks like compared to the normal, it's just a little bit more extreme. I ask for more perfection and I treat you a little bit more like I would treat an athlete. I used to coach and stuff. And it's kind of like, if I'm telling you to do it, you're going to do it. Like, there's no like, oh, well, I had like a family event. Well, guess what? Do you want to get to that point in a rush cut or not? Because if you're giving me a month or 2 months, man, I can't have too many slip ups.
Yeah, yeah. And I was just going to add to that and say, I think it does feed into, or it circles back to that whole like athlete versus gen pop, where people got to realize where they're at, because you can't do these athlete things and do this rush cut and expect great things if you're not willing to commit to 7 days of borderline perfection, which, like you said, is not sustainable. Perfect does not exist long term.
Yeah. And that's the main thing. It's like rush cuts sound cool. And they do. Like if you want to get ready quick, yeah, you could hire a coach that could get you there, but it's going to suck while you're doing it. Plain and simple.
Yeah.
It really is. It's going to suck because it's going to be monotonous. You're probably going to do a lot of activity. You're probably going to train your ass off, and you're probably going to get denied the freedom to want to do some things that you want to indulge in, just for the sake of like getting to that goal in a short period of time. After that, when we come out of it, like he's gonna love his life coming out of it. Like he said he was fine. He's like, I want to continue this. I'm like, no.
Yeah.
You asked to do it in 2 months. We got you there. Like, no. He only wanted to get to 200. So he wanted to lose 15 pounds. We lost 20. And he was like, I'm really happy. I want to keep this going. I'm like, no. We're going to come out of it. Like, enjoy your time in Mexico. Don't go fucking crazy where you come back 15 pounds heavier, but enjoy yourself a little bit. And then when you come back, we're going to start to establish yourself. And this is where like sort of like a primer phase will come into play post rush cut. It's like, let's get you optimized again. And then I know you want to continue. So then we can transition into a more sustainable type of dieting phase.
Yeah, and I think that's where a lot of people are at currently when it comes to, say, the GLP-1s, where they lose all this weight and they're like, this is awesome. I'm just going to keep going. But they don't really know what's around the corner when it comes to losing muscle, potentially affecting bone mineral density and all this stuff, where it's like you need to do this stuff in phases if you actually want, if the goal is health, not just weight loss.
Yeah. And with the GLP-1s, like I'm a huge fan of them, like especially if someone is obese and it gets them in better health, by all means, please use it, because genetically some people just have a really tough time of getting out of that obese BMI. Is, say what you want about it, but it is
for 99% of people, it's appropriate.
Yeah. Okay. You're right. So yeah, say what you want about it, but I feel like it is appropriate for that gen pop. So a lot of people genetically just have a hard time getting out of it. And that if that can do that and improve their chances of longevity, then I'm all for that. Thing is like work with someone like us who specialize in it, right? Like my wife is a doctor. She could, oversee everything that's going on. Me, I'll be handling your nutrition, teaching you the right habits. Like you would be in such good hands to where like when you do come off, you're not going to have that lower lean muscle mass, the bone density stuff. Like, I don't know how much research is behind that in terms of like, well, if you don't focus on your diet, will it exacerbate it or not? Like, I don't know if it's just like it comes with it. But what I do know is that when you focus on your diet, though, you can preserve, especially if you have a higher protein and you resistance train, you will preserve that lean muscle mass. So, and that's the biggest issue that I've seen with it, because a lot of people just take it just to lose the weight, and then they're like, I'm not hungry, so I'm not eating. Like we had a client that was prescribed it and on it, and they didn't want to eat, and I was like, I'm forcing you to eat, man. Like you got to hit this, or don't have me as a coach. I need you to eat. Now it's not like forcing to where they're throwing up. It's just like, no, I need you to hit these minimums, man. You have to hit these minimums because we want to keep you healthy. It's not just about the weight loss. Like we got to keep you healthy. So yeah, I think you made a really good point there.
Yeah, well, I think we're in a unique position seeing this from the other side, knowing what needs to get done, because I do think that's probably the only real big concern right now when it comes to the GLP-1s is not getting the nutrition and the strength training, the education that's required to be in a position like this. Because when you combine them all, you and me see like these people are able to put on muscle mass, are able to burn body fat, and are not in this position that a lot of people are finding themselves, where like the rapid weight loss is causing all these problems.
Yeah. And I think that's a big, like it goes both ways, right? Like, so I see it as like, if you want to use it, use us to help you transition off and to keep you healthy while you're doing it. You have other coaches who are like, you can't use it because you'll lose so much muscle mass and you become skinny fat and like your health will deteriorate. So you need to use my services instead. And it's kind of like you got this tug of war going on. And I'm just like, to be honest with you, like you're not beating these drugs. They're just going to get better and better and better.
All these side effects are going to probably dissipate in the next like 10, 20, 30 years. And it's going to be like part of everyday life.
Yeah, exactly. It's like, and so instead of fighting against that and like going against the current there, which is going to move at a rapid pace, support it, right? Let me support you while you're on it, right? Use my services to make sure that you are doing everything properly and not just like they like to push, like becoming skinny fat or just like losing all your muscle and your bone health. So
Yeah. And that's actually part of the reason I transitioned a little bit more back into the personal training side of things in person, because now one of the best effects I think I've noticed from having these conversations with people on GLP-1s are like, I feel confident enough to go to the gym now, or I feel better, or I feel less pressure on my joints. So now I can actually work out. And it's incredible.
yeah. Yeah, I see that a lot. Like even with clients, it's kind of like you start fixing their nutrition and they start losing a little bit of weight. And now they're like, well, I want to walk more. And then it's like they start walking more and they're feeling better. And they're like, well, now I want to get to the gym and start working out. So it's like you have this snowball effect with where one thing starts going. So if people use the GLP-1s to lose a little bit of weight and you're there to personal train them and they're like, hey, I now feel good to come in. Well, come in, let me show you what to do, man. That's it. Like I
Yeah.
got your back. Yeah.
Yeah.
So
But jump on the train. Let's go for a ride. Like you're about to experience the best thing ever.
oh yeah, love that.
Now, I know we touched on a lot of things, but the thing I did want to cap off on is because I know a lot of parents listen to this podcast. That's probably like the majority of the people. And I'm
Mhm.
curious, how has things changed since having your daughter, like as far as your training, your nutrition, just like stress management, anything and everything?
Stress management, I got to work on that one.
Well, to be fair, the sleep probably isn't ideal, right? A little harder to
It's
do.
I'll tell you what, man. In the beginning, it was rough, but she sleeps pretty much through the night now, and she's just 4 months. So we
Oh,
got
that's
lucky.
awesome.
We got lucky with that. I work from home. My wife works at the Hill Air Force Base, so she's the chief practitioner over there for the Air Force. So I'm with the baby during the day, which is where like the stress management needs to come into play. So I'm with her for about 10 hours a day by myself with a hurt dog. So it's a lot on my
You're
plate.
really making me excited for this phase of my life in a few years.
So it's a lot, man. It's a lot. And I get times where I need to vent. Like I got to tell my wife some stuff and like just get it out. I've screamed in a pillow before. I did that. Like you're trying to put the baby down because you're like, I got to work out or I got to hop on this client call and she's crying. And it's like, how can I get her to stop? And like, you're doing everything right. And it's just different, right? Patience, I'm building. It's coming. The stress management, I could work on a little bit. But overall, I mean, I never knew I could love something like this. Like I know your parents probably tell you that, like when you're younger, you'll never know what it feels like to love a kid. They're right. It's something completely different. My nutrition, it's very simple. So I don't make it extravagant. I eat the same breakfast. I eat the same lunch. For dinner, it's usually probably like the same lunch, and then I have like a yogurt meal at nighttime before bed. Dinner's the only where like I veer off if I'm cooking dinner and like I want it to be a little bit different from what I normally eat, then I'll do that for me and the wife. Otherwise, she's fine with like what I eat anyway. But nutrition's I keep it as simple as possible. So it's the same stuff and it's the stuff that I enjoy. So not a ton of variety there. So that's the way I navigate through that. With training is very difficult. So I have a gym here. It doesn't have everything I need, but it has most of what I need. Plus I have that torn bicep. So I'm starting my own physical therapy with that, where I'm curling like, Fisher price dumbbells and stuff with it. But doing that by myself, like finding the time to do that, like I can't have a schedule. That's the biggest thing that I realized. Like I can't say every 10 a.m. I'm going to go work out. No, 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 no. It's got to be around that. So there's got to be a range that I could work with because when she goes down, she's going down. She might stay down for 20 minutes. She might stay down for an hour and 20 minutes. It all depends. So it's been difficult, but I mean, I'm still in what I would consider pretty damn good shape. So I'm still there. I didn't let myself go. I didn't get a dad bod or anything like that so far. But I would say the biggest hurdle for me right now is the patience and the stress management a little bit. I don't know how to deal with that yet. Like the walks in nature that I talked about, it's hard to do with a hurt dog being at home and the baby. So maybe once he heals a little bit and she gets a little bit older, that's where I would revert to. But right now, it's really just like don't expect to have a schedule. And if you talk to my wife, she's like, Vinny is very regimented. Like he plans things out, and if you veer off that schedule, he gets aggravated. Like it's like what we have to do is like I have itineraries and shit that I like to follow. So it's it's an evolution for me. It's sort of it's what I need, right? I can't be in this life. You want to evolve and grow, and she's definitely doing that for me. But I will say this: she is a very very happy baby. So she smiles a lot. She laughs. Not a ton of crying. It's just like when you want her to go down. Sometimes she's just I want to stay up.
Yeah. She's like, I want more dad time. Come
Yeah,
on.
that's it. I'm playtime for her.
Yep.
When mom comes though, a little bottle feed here, a little hug, and she's out. Like she's napping. With me, it's like I gotta put her on a treadmill or something.
Hey, not a bad idea. Get her into fitness early. Yeah, I mean, it sounds like, especially with the regimen, like that's the competitor in you. Just like that's the identity where it's like this gets done. We can expect this, and this to happen. And anybody listening right now who feels overwhelmed, I mean, you just listen to Vinny. He's got a newborn. He's got injuries. He's got a dog that's on the mend, and all I'm hearing is simple and flexible.
Yep.
That's what we really need to lean into in times like this.
That's great that you said that. I'm gonna use that as an Instagram.
There you go. There you go. So that's like honestly the I guess the essence of this podcast is like keep it simple, keep it flexible. We don't need to put all these barriers on getting healthy.
Yeah, yeah. And when in doubt, ask for help. Like,
Yes.
ask for help, please. Don't pretend that you know how to read labs if you don't know how to read labs.
Just marry a doctor. It makes life so
Yeah,
much simpler.
yes.
Two guys can tell you from experience. But before we wrap up, if somebody heard this podcast and they made it all the way through and they're like, "Damn, Vinny knows his stuff. I want to see more of him." Where can they find you?
Yeah, Instagram is my main social media. I focus on that pretty much 90% of the time. So that's Vinny Russo _ balanced bodies. So you can find me there. You can go to my website, which is balancedbodies.io. You can go there and check out myself and Dr. Erin, and my wife. That's what we call her, Dr. Erin. So you can check her out. I do have a TikTok. It's here and there, but definitely Instagram is the way to go. And if you ever had questions, I love answering like random people with questions. It's just keeps me on top of my game and I'm adding value. And I feel like I got this tattoo on my fingers. It says SEVA, SEVA. And it means selfless service. So do for others what, sometimes they couldn't do for you. So if I could answer questions and help people out, it's a value that I want to instill in my daughter. So you'll help keep that in line with me. So yeah, those are the places to reach me.
Love that. And as you guys all know, if you're return listeners, it's all going to be down in the show notes in the description, wherever you're watching or listening. So just go click away, find Vinny, find his stuff, and you'll be thankful you did because he puts out incredible content. Now, as a thank you to Vinny for coming on, it would mean the world if at any point you heard something during this podcast that really resonated. You have that person in your head right now. It's like they are obsessed with their labs or like they're doing these fad diets. They're like, they need to hear this information. Go ahead and send it their way. They'll be thankful you did, and so will we.
Share it, please. Because
Yes,
listen, there's a lot of misinformation out there. So we have to try to combat that with good information. And there's a lot more bad information than there's good. So the more you share this, the more chance you get to help someone.
absolutely. So, Vinny, thank you again for coming on. Really appreciate you taking the time. And again, for everybody who's listening, thank you for making it all the way through. I'll see you guys next time. But until then, go kick some ass. Later.